competition we were in took place at the University of Alabama, Birmingham. It's called the UAB Case Competition. It's the premier healthcare case competition in the country. About 26 schools participate. They give you a real-life case that took place somewhere, and then you approach it as if you were the managers or consultants on that case, and you present your recommendations to a panel of judges, and they can give you feedback on those recommendations. Our case was on physician alignment, and what that means is that there was a hospital in the community, and it had some physicians that were employed by the hospital, but also a lot of independent physicians. And so our case was really to recommend how they could align the physicians with the hospital so that they could take the best care of the people in that community.
So what we had to do was, given their resources and given the area and what we knew about it, construct a comprehensive financial, strategic, and operational plan to bring them out of this situation and provide them a sustainable business model and revenue picture going forward in the future.
The recommendations that we made in this case were really spot on to what happened in the actual case.
They actually have already implemented a lot of things that we recommended. There are a few things that we recommended that they have not implemented yet, and I think the CEO is interested in some of those recommendations that we had.
I think we won because our recommendations were solid, and that was a result of all the resources we have at the University of Minnesota MHA program.
As well as some key personnel here at the university. I will mention Dan Zismer, Sandy Potoff, and there were certainly a few other individuals that played a crucial role in our development of our recommendations. But Dan, really, his knowledge of integration and what works, what doesn't, what are the major issues when integrating with physicians, those were some of the key insights that really drove our strategy and contributed to our success.
I think the other thing that really helped us was we were able to reach out to our alumni network. We do have a lot of CEOs and integrated delivery systems across the country, and we're grateful to be able to contact them and fit in their busy schedules, and they dropped what they were doing and helped us, which provided some real application to what we were working on.
And getting experience in that field, in that domain, has been extremely beneficial to myself. I know the institution that I'm going to after graduation, one of their main strategies is going to be something around alignment of physicians. And so for me personally, I've got this experience now that I can parlay into real-world experience in the next 6 months and over the course of the next year and years into the future in my career.